It's time for Science and Medicine, a collaboration between TPR and the UT Health Science Center, San Antonio, where scientific discovery advances how medicine is practiced everywhere. I'm Bonnie Petrie. When Congress wanted to hear from one of the nation's leading experts on long COVID, it looked to San Antonio.
Thank you for inviting me to speak today. My name is Dr. Monica Verduzco-Gutierrez.
Dr. Verduzco-Gutierrez has been running 2 long COVID clinics since early in the pandemic, and she says every case is different.
I always say if I've seen one patient with long COVID, I've seen one patient with long COVID. So it's a whole spectrum of disease. Definitely fatigue, but it isn't just the kind of normal fatigue that someone has when they're tired at the end of the day. This is a debilitating fatigue, or they can have post-exertion malaise or symptom exacerbation. So that means they may do an activity and then they have a crash. Patients can get headaches, they can get pain, they can get ongoing chronic coughs, they can get changes in their blood pressure. There's also a lot of autonomic changes, which is a fancy way of saying their heart rates and their body vessels aren't squeezing and responding the way they're supposed to. So that can cause palpitations and dizziness and lightheadedness, and then they get brain fog.
Dr. Verduzco-Gutierrez says about 10% of people who are infected with COVID, even if their case was very mild, will go on to develop symptoms of long COVID. And UT Health San Antonio is on the leading edge of research into the syndrome, participating in the National Institute of Health's RECOVER trial.
We're the only one in Texas that is recruiting in the RECOVER trial. And then hopefully we'll be starting some treatment trials for long COVID through RECOVER as well.
That's Science and Medicine from the UT Health Science Center, San Antonio, and Texas Public Radio. I'm Bonnie Petrie.